with our host, Dr. Jack Rocco. Dr. Jack, how are you? And you have some experiences to talk about in this solo podcast today, right?
I do. Yeah. I started back. It's been a contemplative week
Mhm.
for a lot of reasons. I started back in with orthopedics. I'm doing office-based ortho now, and it's good to be back on the horse. I'll tell you that. It's nice to be it's nice to be back in ortho. And I'm also glad and proud of the time I spent doing liposuction for the last 2 years. And I think that's kind of what I'm thinking about for the conversation today is the 2 years that I took doing lipo, I think was very eye-opening for me um, into really the extent of the obesity epidemic. It's something that fortunately, knock wood, I've never really had a big issue with my weight. I think some of it's genetics, a good deal of it. But also I always stay active. I'm like you, Neil. I'm sometimes a little hyper Dan, you're always busy, always doing stuff. So, sitting around watching a TV show for any length of time is just not going to happen with me. So I'm active. And I do, I watch what I eat now, but I can't say that growing up, I didn't eat a lot of volume, but our generation, I think we did eat a lot of, the fast foods, the McDonald's, um, and the snacks. We didn't do it as much as they do nowadays. But like I said, this week coming off the 2 years of doing liposuction, being back in the ortho office, I really appreciate those 2 years because it really helped me to understand the obesity epidemic from a more frontline aspect of things. And with ortho, you do get kind of focused in,
Yeah.
hey, you're too heavy. I can't do your knee anyways. There's four guys behind you who need to get their knee replaced. So you become a little focus driven. And now that I'm doing office, and I learned a lot during those 2 years, not just about doing liposuction, but I really dug deep into into nutrition, into weight loss, into the importance of visceral fat, all those things that I didn't really focus on much, A1C, a lot of the health metrics, and also the testosterone. The benefits of testosterone, if you can do one blood test, as a man, if you can do one blood test that's going to give you an idea of your total health, let's gauge where you are. Testosterone is a great indicator for how you're doing health wise. The heart benefits, the muscle benefits, the bone density, um, the mental, depression, all these things are tied together, but particularly the weight loss. And let's talk about that. Like, I said, for 2 years, I was doing liposuction full time, and I enjoyed it. It's very gratifying. The results are dramatic, as far as you got your before and after. Everyone loves seeing those before and afters, you know. But I think
Yeah.
the thing that always kind of loomed over my soul, if you will, is just, yeah, but are they any healthier? You look better, yeah, but are you any healthier? And
Hmm.
often the answer is no. You are not healthier with liposuction. You might look better, you get in your dress, you feel better. I do think that there were a lot of, orthopedic benefits to doing the liposuction, especially in the patients that we would do lipo, and sometimes you're taking off 4 or 5 liters of fat. 5 liters is the state limit in Connecticut. And that's probably most common, 5 liters of fat. But you're not addressing the visceral fat, which is the most important fat, and the deep visceral fat that's around your organs, around your heart, around your intestines. That's the stuff that really kills you. And I always say that's the guy who, I've got all these buddies and they're like, hey, doc, what can you do for me? And they show me their big belly. And you pound on their belly, and it's literally like, hitting on a table. They've got very little superficial fat. There's very little pinchable fat, but everything behind the abdomen, behind the muscles. They're like, see, doc, it's all muscle. No, it's not muscle. You're pregnant with fat. So that visceral fat is really, when we're talking health, as opposed to cosmetics. Cosmetics, lipo does a great job, but so the women that we would take off 4 or 5 liters and then do a skin removal, take away that pannus of hanging skin. Those women did great, and you'd see them a lot of times in their before pictures. They're leaning back and they're leaning back to maintain that center of gravity, their center
Right.
of, because with the stomach in the front, if they didn't lean back, they're going to fall forward on their nose. So they just naturally over the years start to lean back. And the way the spine is designed, the spine is a tripod. And you've got your vertebral body in the front. I'm trying to do my Italian talk with my hands thing, forget about it. But normally 80% of your body weight, 80% of your weight goes through the vertebral body. And then 20% is shared by the facet joints in the back. So a good spinal alignment, has about 80%, and that's balance. That's a good posture. As your weight goes up, and a lot of times I use the analogy of that truck driver who gets out of his car, and you see him, he's got the big belly, he's leaning back, his belly's going over his belt, he's pulling his belt up. Those guys are always leaning back. They have the worst backs in the world
Yeah.
because they said instead of an 80 and 20, now they go maybe to 70 and 30 as they lean back. As they start leaning back just to maintain posture, to not fall forward. Now they're maybe doing 70 30.
Mhm.
Maybe they're doing 60 40. So you're putting 40% of your weight or 30% of your weight on two joints that are only designed, their tolerance is for 10%.
Right.
So joints will frequently wear faster. They'll become arthritic. As they become arthritic, the bone starts to form spurs. The spurs will then encroach upon either the nerves, the spinal nerves that are exiting right around that area, um, or into the spinal canal, and that's where you get spinal
Wow.
stenosis.
Okay.
So that's the mechanism of spinal stenosis, and the mechanism of pinched nerves in the back. So
Right.
it's a progressive disease that, once again, is from weight loss. So
Right.
you'd see these patients, lipo patients, their before pictures, they're like this. You'd show the after, the skin is gone, the fat is gone, and now they're standing more upright. And that's a beautiful thing. And they're like, yeah, my back doesn't hurt, my knees don't hurt. You've restored that alignment. And orthopedics is all about it's physics and mechanics, and I said tolerances, what this joint will tolerate. And we abuse it. We abuse it
Right.
with sports, we abuse
Absolutely.
it, but the weight especially. So the things that I'm frustrated with now,
Right.
getting back to ortho, but also excited about going back into ortho, is that before my time at with the lipo, I always felt kind of helpless with the weight loss. Um, and not even knowing what to tell people, what to talk to them about. But now with that in my background, I spent a lot of time this week talking to patients about their weight. So I'm integrating the pieces of my life and the pieces of my experience professionally, into my repertoire now. And I
That's
like
great.
I like that they come in and I'm like, yeah, your knees aren't that bad. I said just a couple of the patients I had this week, your knees aren't that bad. A little bit of arthritis, you're 55, you're 60. Your biggest issue is your weight. So now, as an orthopedic surgeon, I'm giving them advice on their diet. I'm talking to them about possible testosterone because a lot of these guys, they all have low T. They've got that, abdominal visceral fat, and they have the orthopedic issues. So I like that I feel as though I have something to offer them now more than, hey, buddy, you're too
Right.
heavy.
And that's all. And
Your
just
knees are
we're
going to
going to
hurt.
operate on you.
Your knees are going to hurt, and they said if you keep going to an orthopedic surgeon complaining of knee pain, you're eventually going to get a knee surgery.
Right.
It's just the nature of the beast. But and the partnership that, as a part of the men's clinic, we've partnered with Life Vantage, which we had Jeff Piccirillo, I think he is more the better pronunciation. those products, the products from LifeVantage that I have available to me in my arsenal. And the GLP Mind and Body product is fantastic. That's the thing that where Jeff lost 75 pounds. I'm not sure where he's at now, but he was upwards of 70 pounds that he's lost, and he looks great. And that it all makes sense to me. It makes sense. There's clinical evidence for it to support it. And I've seen it. I've seen it clinically. And the product that they do, they call it, GLP Mind and Body, and it's two stages. They do a stack. And the first stack is their flagship product, which is called Protandem. And
Okay.
Protandem is a super antioxidant. The catchphrase or the word that physicians and chemists use is free radicals. Free radicals are all those that oxidative stress. When people talk about oxidative stress and toxins to the body. Oxygen is a bad thing. Oxygen causes rust and causes,
Yeah.
there's a lot of degradation that goes on with oxidative stress. You need oxygen, but you put something in a vacuum bag, you remove the oxygen, you remove the stress, you know. So it's the same thing. Like our bodies, the food we eat, it's frustrating to me too. I just did a long trip down from I'm in North Carolina now, did a long trip down. And it's a 12-hour drive. And as I'm driving, of course you get hungry, you got to stop to pee, get gas. Um, the choices of food, at these stops is just horrendous. I'll try to go to one of the convenience store, maybe get some nuts, maybe get some, jerky, but still, it's all still processed, and there's very few good options. So of course, you're hungry, you're tired, you want to stay awake. So I had a little Popeyes chicken yesterday. Horrible. I mean, I just, I got a two-piece. I knew I shouldn't have done it, and it killed me. It killed me. I was just like, kept me awake for a little while there, and then today I'm just like, oh, I just feel,
Yeah.
you know. Um, but the idea with the Protandem, I got down here, I took my Protandem. Um, it helps to deoxidize. It helps to get rid of a lot of that oxidative stress that bad food, that bad trip, the low sleep. It helps to clear out your system. And then once you clear out your system, your own cells can start working better. You have the capability. I still do believe, I'm a physician, and I know, a lot of physicians, it is geared towards pharma. Come in, write a script, write a
Yeah,
script,
exactly.
boom, boom, knee-jerk reaction. You have high blood pressure, let's give you an anti-blood pressure. You have high cholesterol, let's give you an anti-cholesterol drug. It's this linear way of thinking, which has just predominated our profession. Um, but no one is any healthier. Some of the stats on children, the poor health in children nowadays is just it hurts my heart. It hurts my heart. That you never had diabetes in children,
Right.
and now there's something like 30%, a third, one in three children are diabetic or pre-diabetic.
Mm.
And this is with, the quote unquote best healthcare in the world. Well, you can't substitute medicines and healthcare for poor diet. There is no substitute for it.
Mhm.
I mean, I know you're big into the hacking and hacking and
No,
hacking.
so see, but
You know,
see, you
I
kind of woke
get
me
it.
up and then I got crazy
Yeah,
because
I
I
get.
was starting to, you woke me up when you talked about the stomach. And I'm like, okay, yeah, I am getting back because of the yoga, but my stomach isn't doing anything. I need to do something about that. So that's when I started back to the fasting again. And it was a bit, but I did it before. So I go on these roller coasters and then I use that scale because that scale is such a identifier. And
Hmm.
the reason it is yeah, you could feel like you're not gaining any weight and you literally, your clothes could still be fitting the same, but you're literally putting new calories on. I mean, more pounds on. And
And
you
it's
get
a
on that
dis-
scale and you're
yeah.
like, holy cow, I shouldn't have eaten what I eaten yesterday.
Yeah, it's a body composition, the composition of your body. Fat by design, the Lord or Mother Nature, whoever's in charge of these things, um, fat isn't intended as a way to store calories in a without the burden of carrying all the calories. So, muscle is much heavier than fat.
So
It's
yeah, I don't know.
all the
It's
components.
it's hard, but I know if I ate and I put on a couple pounds, oh, but I better back to my fasting.
Yeah,
And I feel it feels good when you fast. It
right.
feels good when you don't overeat.
Yeah,
It
your
feels
body.
when you're not stuffed. Go ahead.
Yes. Oh no, a lot of these things are just common sense, but we get so wrapped up into the traps, the Instagram traps, the life traps. Oh, hey, I tried this, I tried this, you know. Um, but it really all comes down to basics. If you fast, your body will clear those toxins. When you're eating, every few hours, you figure if you're sleeping for 8 hours, you got 16 hours, and you're jamming 3 meals often, 3 meals plus snacks into your 16 hours of waking. So that's pretty much constant eating. There's always either a meal or a snack for a lot of people, and then the quality of the snacks is horrible. The quality of the food is horrible. So there's no wonder that our bodies are loaded with all these toxins, antioxidants, free radicals, and your cells don't work as well as they used to. And for me, because I live in the world too. I live in the world. I'm stopping at truck stops. I'm going to gas stations. And you try to. You're hungry. I'm busy. But it's very difficult to run into a Whole Foods and get yourself some
It,
nice.
it may it may I guess it makes it better the fasting because of the fasting, then you
Yeah.
know you're gonna get that one good meal.
Right.
I get clean eats. Clean eats is
Mhm.
unbelievable food. Unbelievable food for affordable price, and you buy it for the whole week, you get it customized, and then you have that for your dinners, and it's like perfect.
Yeah.
And I don't wish there was a Clean Eats everywhere. There's one in where I'm at. I don't know if you've seen Clean Eats before,
I've not.
but
I've not been.
it's really good stuff. But that's the type of stuff you have to do.
Yeah.
So I guess what we're learning from this one is it's a wake up call in so many ways, getting to treat these patients. But it looks like you going back to this is going to help them so much more because they're not getting that conversation with their doctor
Yeah.
because it's just how it is.
We never got taught nutrition. Like I said, I said, I mean, when I was younger, when I was in medical school, college, I was an athlete. I ate well. I maintained my weight. But during residency, I remember during residency, but probably my intern year, you're so busy, you're putting in 120 hours, you're always in the hospital.
Right.
I'm thinking like, man, I hardly ever eat.
Right.
I'm always working. I hardly ever eat. And at
Right.
some point, maybe 4 months or more into my intern year, I finally found a scale and I jumped on the scale. I was like, holy, where
Yeah.
did this come from? You know,
So,
it's
yeah.
like, it's 2 in the morning. I mean, these are true stories. It's 2 in the morning. You're working in the ER, and Sandra was the woman who used to push the food cart through the ER. And you're like, hey, Sandra, can I have a cup of coffee? And why don't you give me? We used to call them the D50 donuts. Those cream-filled donuts with the powder sugar. You're like I said, you're 25 years old.
Yeah.
Little coffee and a donut never hurt anyone. Well, 6 months into my residency, suddenly I'm like, this can't be. Like I put on 10
Yeah.
pounds. I feel like
Exactly.
I'm not eating. I don't, I hardly
No.
ever eat. I'm always busy. But meanwhile, like I said, you're throwing a couple of those D50 donuts down your throat
Exactly.
in
Uh,
the middle of the night. And the exercise you're doing, I mean, it's fatiguing, but it's not really muscle. But
exactly.
like I said, I've always lived kind of the holistic thing. I've always fortunately been able to balance my weight and my
Right.
exercise. And I'm knocking on, I'm in my late 50s at this point. And I think I'm doing pretty good
Yeah, you
considering,
are. All
you know.
right.
But yeah,
So
like I
where can
said, I think
people check the best place to check you out? Where do
yeah,
you
I
where
think, like
do
I said, I'm working at Primacare in Fall River, Massachusetts, and 15 minutes down the road is the Ultimate Men's Clinic in New Bedford, Mass. And I'm bringing all these things together. My experience from lipo, my experience from, Life Vantage, and the nutritional products that help. The fasting is great. The testosterone. It's the pieces of the puzzle. And at this point in my life, I couldn't find the perfect job for me. So my intention is to build the perfect job.
that's smart.
A little health, fitness, awareness, some orthopedics, some testosterone, some men's health, some cosmetics. And I think that's the key. But no one piece is the key. Other than, like I
Think
said,
so?
if you had one thing, your weight, your testosterone level, and your diet, that,
Well,
but the point is health and wellness, not illness and pharmacy.
okay. All right. That was a special simulcast, the Neil Haley Show and the Ultimate Men's Movement. Go to the Ultimate